Hi, everyone, and welcome to our Advances in Autism Research and Care webinar. We're thrilled to have you. We're really excited about our presentation today. Before we get started, I'll just give you a few housekeeping reminders. The first one is that all of our webinars are recorded and uploaded to our network YouTube channel following the presentation. So you will get a link to the YouTube channel after your attendance, and then if there's anyone who missed the presentation, you can feel free to pass the link along to them as well. And then the second reminder is that we will have a brief question and answer session for our presenter at the end of the presentation. So you'll see the right sidebar on your screen, there's a questions tab. So if you want to put any questions you have in that tab, they will go to me and I will read them out to Amy, our presenter, at the end. So without further ado, I would like to introduce Dan Corey. He's our Network Medical Director. Dan, I'm going to unmute you and he is going to introduce our presenter for today. Take it away, Dan.
Great, thanks very much. Welcome everyone to this afternoon's AARC webinar. I am really pleased to introduce Amy Hess, who I have known for, I won't say how long. But
thank you, Dan.
Amy has been with Nationwide Children's Hospital for the past 7 years, and I actually worked with her before then when we were both doing some work at the Ohio State University in the University Center for Excellence there, the Nysonger Center. Amy is currently at Nationwide Children's and is the Behavioral Health Outreach Supervisor. And through that, she focuses in her autism work on our learning health networks, on primary care engagement and education in the community, and both local and national community outreach for autism, as well as other health categories. She, you may recognize her name from her work as the Family Advisory Co-Chair for the Autism Learning Health Network, and she's been involved with our ATN AARC FAC for many years as well. She's also the parent of Henry Hess, who is a talented young man who is an artist with autism spectrum disorder. He has been in his own art studio since the age of 13, and seeing Amy and her husband Tom promote Henry's work and provide him with the guidance needed to be the successful artist that he is has really been inspiring these past several years. With all of that, I'm going to turn this over to Amy to tell us about Family Echo, just one of her many projects associated with our network and with Nationwide Children's Hospital. It's all yours, Amy.
Thanks, Dan. It was a very nice introduction. We have known each other for a long time, so I really appreciate it, and I've loved working with you all these years. All right, everybody, so we're going to talk about Family Echo today, and this is a little weird because I do a lot of Zoom calls, like all of us probably do, so I'm used to like having like a lot of visuals, so I can't really see anybody, so chat things in if you need to, or however that happens, and we'll go from there. So for our agenda today, we're just going to do a quick overview about how the design and implementation of Family Echo happened, how we sort of formed our hub teams, and how we recruited and marketed to participants. I'll talk a little bit about a quality improvement measure that we tracked, and then we'll talk about the next steps we have planned for 2021. So how did Family Echo come to be? Well, it's a new series that we developed here at Children's, and we developed it in 2020. And the series was really initially developed in response to COVID to address the behavioral health and support needs of families and caregivers of children with developmental disabilities, including autism. And I'll tell you that as a department, we were having almost daily meetings as the shutdown was occurring in March 2020. And the focus of many of those meetings was really on how to address the needs of our patients and our families. And it was becoming really apparent that families were reaching out for a variety of needs, from diagnostics to access to care. Behavior management was a huge part of that. Family support was another really big part of those outreaches to our department. So the idea of Family Echo was born from those discussions, and the topics mainly focused on behavior management really bubbled up to the top. We designed Family Echo with a focus on providing education and knowledge, as well as resources and possibly access to professionals on topics of behavior management, family support, executive functioning, you'll see became a part of it, healthcare, and so much more. The target audience for Family Echo was really designed towards parents and caregivers of individuals with autism and other developmental disabilities. You know, one of the things that Dan always says is that autism seldom walks alone. So we really wanted to make sure we address those comorbidities that were part of some of the issues we were seeing families call into our department about. Our series, you know, as we developed, we found that we drew predominantly parents and caregivers, as well as parent professionals. So someone like me who sort of works in the field, but also as a parent. But we also found that in addition to these really strong family participation, you know, partners that were coming to these echo sessions, we found that we were having some community providers who work closely with families, providing some kind of a service, and they were eager to build their skills and knowledge to better serve their clients. So what we found is they were having some of the same discussions within their departments of how they could really, you know, help families during this, you know, this time of uncertainty. And I'll talk a little bit more about that later. So of course we launched a never before tested series and a concept during a pandemic, during a lockdown. I mean, why wouldn't you do that, right? So we just put it out there, and Nancy Long, who is my, you know, my right arm to everything that we do, echo related or outreach related. She's on the call today. We just had a conversation in the hallway, and we talked about how did it even start? Because her memory is, I just remember you saying we're starting this in 2 weeks and we got to build it and make it happen. So, you know, it's that theory of start before you're ready and see what you can make happen. I'm often really asked about how, you know, we built the hub members around this project, and it actually was, you know, an amazing response on their part to an email that I sent out saying, hey, we have this concept of Family Echo. I asked if they would like to participate as a hub member or even be a presenter. And I have to say I received an overwhelming response from many of the people on this team. So I have an old picture, because of course we don't get together like this anymore, of like what our department looks like. It's an old Christmas photo I always like to use because it's fun. But their response was overwhelming, and their dedication to families was apparent during the meetings I was involved in, but even more so when I made the call to say, what do you think of this concept and would you be a part of it? You know, and I think due to their dedication, you know, we aim to give them, meaning these professionals back, enough time to plan their clinic schedule so they can participate. So it was one of the factors that we started try to juggle around to make sure that they were able to participate as much as they wanted to. There we go. So we have a core hub team member, or a core team of about 18 hub team members, right? And it's a variety of disciplines. We have a lot of psychology, marriage and family therapy, social work. We have a transitional specialist who's based here in psychology. We have developmental behavioral pediatricians and family partners as part of our core team. We also have our clinical research coordinators who help to support the series by opening the Zoom line, managing participant issues pre, during, and post session, and they really work to ensure that the slides and everything's ready and set for the sessions. And I have to say, they're an amazing group, and without them, we could not do a lot of our echo group or our echo work. I know 18 sounds like a lot of hub team members, but remember, not all 18 really attend at the same time due to their clinic schedules. They rotate in when they are available. We've had as few as 4 hub team members that have shown up, plus support team. I mean, we've had as many as 12 on one session. So these, you know, really these amazing hub team members support the presenter. They assist with questions. They monitor the chat. They act as chat cheerleaders. They identify participants who may need, you know, more direct up, and they just really continuously help to define the series and where we can do better. In addition to that core hub team that I just talked about, we have a few specialty hub team members who also presented during 2020. You know, we had special guest hub members from the community, which included an education transition specialist from Columbus City Schools, and an active parent who also works for the state of Ohio with Employment First. And we really pulled these 2 in because they're part of our Allen network that Dan talked about earlier. They're part of our Allen parent team, and their experience in Allen, as well as healthcare and their specialty areas in school and employment, were just really valuable to the series. So their parent and professional experiences fit really nicely with the goals of ECHO. In addition to that, we had other specialty hub team members from the pediatric psychology department here at Nationwide Children's Hospital. We actually had 6 pediatric psychologists who were really really focused on doing a 3-part series. It was called Executive Functioning. They loved it. They were great. The series was really well received, and they want to be a part of it again for 2021. And one of them actually has a new ECHO idea that she wants to meet with me tomorrow about. So we might have something new coming. It'll be interesting to see. So we did a call for topics with these hub team members after we sort of got an idea of who was going to be available and who was interested. And they brought forward topics that they felt were important to families, that they were hearing from patients and families during clinic visits, and also that they had a passion to convey to families. And it's the one thing I always say to a new hub team member when I talk about Family Echo. If they say, well, I'm not sure what to talk about, I always say, what's your passion? Because that's really, I think, the connection that families can make to that presenter and to that topic, is they hear the passion, they hear the dedication to the topic, and it really just bodes well for everybody in that session. So from this call, we had nearly 30 sessions that were developed with hub team members. But what we did is we carved it down to an initial 26, which is still, when I look back, I can't believe we did 26 in 2020. So here are the 26 sessions we did during last year. 10 of these you can see are really focused on behavior management. There were 2 3-part series offered. One was on schools and going back to school and in the time of COVID. And then we did another 3-part series that was on executive functioning, like I mentioned before. Each of those were really well received, and I think timing wise hit right when they were supposed to. Family support sessions were some of our most popular and well attended. We also offered a few sessions on safety, integrated care, and medical follow-up that were presented by our developmental and behavioral pediatricians. And then we did a dad session that was led by one of our psychologists here at Nationwide Children's, and then our parent partner, Tom Hess. And it's actually had quite a bit of activity since that session. The state of Ohio is really looking to engage these 2 hub members and see if they can design a more permanent and ongoing father support group. So we're going to keep them a part of our ECHO work, but also we're really excited to see where they take that concept. So we really tried to provide a more in-depth description of the session, so I thought I'd share that with you here today. Our highest attendance occurred during April with an average of 116 people attending each session. It was our highest month. And I know Nancy's going to laugh when I say this, but for the very first session, we had registration that was well over 300. And we kept saying, should we shut it down at some point? And, we kind of felt like after 100, why would we do that? Like, might as well let it ride and see what happens. I think we had 130 that actually showed up and participated in the session. And after we sort of managed that large list, we thought, well, let's just keep it open and not really reduce it, and then see how we can make it work. We offer our family ECHO sessions during this. Initially, we offer them during Tuesday and Thursday afternoons, and we trialed 5 for the first month to see how it would go, and they were very successful. As we got into May, you'll see some of our offerings of behavior management got really specific to things our clinicians were hearing families struggling with, like compliance training, disruptive behaviors. Building leisure skills was very popular because people had a lot of downtime, and building leisure skills fit really nicely into this month. And again, in May, we offered 5 sessions. As we got into June, we decided that safety would probably be a really good topic to offer, and Amy Newmeyer, our developmental pediatrician, offered that session, which was really highlighted a lot of things that families should keep an eye on. And we also reduced it down to 4 sessions this month because summer was coming. We felt like people may not have as much time to attend, so we reduced it down a little bit. And this was just so much more manageable for our team. I think when you offer 1 session a week, it's manageable. When you start to offer 2 a week, it can get a little crazy. And then in July, we actually had some feedback from a lot of the participants that they would like to hear more about feeding. So we added that session for July. And then as we got into, the August and September months, we reduced it again to 3 sessions because school was starting to ramp up, and we wanted to make sure that, families could still participate, as well as we were feeling more activity here at the clinic, and we wanted to make sure we could manage that. We also had another 3-part series during this time of returning to school, which was really timely because school was still sort of not sure what was going to happen, so there were lots of questions. And we added to this panel discussion not only our parent partner with Columbus City Schools, but she also brought in a few other people to help talk about IEPs and accessing services and those kinds of things during that discussion. And then we finished up the year in October and just offered 2 sessions. This is when we did our parenting one. And then we talked about integrated care because, you know, a lot of the questions we were getting from families were that they felt like they were sort of working in a cylinder. They were meeting with one person and one person and one person. And so we wanted to talk about integrated care and how important it is to build those teams. So we developed marketing. We developed like just how we were going to market the series. So we released like monthly offer-ins. So we designed a standardized flyer so that it became really recognizable, especially since it is released monthly and participants can choose individual sessions to attend. So even though like in April there were 5 that were listed, you could attend just the one that you wanted to. You didn't have to attend all of them or register for all of them. So registration on the back end got really kind of intense because we would have people that would register just for sessions here and there. So we really had to work out a system that could handle that. We also posted the series on our webpage, which is being redesigned currently. And so hopefully our 2020 series will be up soon, or 2021 series will be up soon. But we made sure to word the flyer to say that Family Echo uses, you know, Zoom technology to connect you with a team of interdisciplinary experts for presentation and discussion on topics related to improving and managing behaviors, self-care, family supports, resources, so that again we could really convey what the series was for. And the session was open to parents and caregivers of children with developmental disabilities and autism. We didn't want to limit it to autism because we don't, within our clinic walls, while we focus on autism, we have other children coming in with other issues and families that need. So we really wanted to make sure we opened it up a little bit more broad. We found that families who participated had children and young adults with not just autism, but they had IDD, CP, ADHD, Williams syndrome, anxiety. We had some that came with PTSD, Down syndrome, and a host of other special healthcare needs. And it was interesting because the highest range of families that participated had children in the age range of 5 to 12-year-olds. And then the next age range was 13 to 17-year-olds, and followed by the third in line, which would have been 2 to 4-year-olds. So we really wanted to kind of get an idea of age range and need, and then disability. And we did that all through our Red Cap registration. We utilized many marketing strategies and the ones I'm going to talk about right now are really NCH based, so things that I could do within the hospital walls here. We have a family education department, and I contacted the leads who have a large guest list of families who have participated in other NCH educational offerings, talked to them about Family Echo and how we could, sort of market and work together to make sure we got the word out. I also worked with our physician liaisons team, and we hoped that they would share this with their providers, who then those providers would share it with families. And they really liked the concept, so they were very happy to send it out. And we send a lot to physician liaisons office about other Echo series, but we really made sure that we specified that this one was to those providers for the families that they were working with. We also shared flyers across developmental behavioral pediatrics, speech, occupational therapy departments to, again, reach families who may be interested. Another avenue we tried was our NCH home care team. They work with many families, in home settings to, support in healthcare needs in a variety of ways. And we thought that this may be another pathway to sort of do some outreach to families. And then, of course, we always work with our family advisory group that's here at the hospital. It's a large, I think there's probably 50 people on the family advisory committee here, and we always work with them and partner with them as much as possible. In addition to the NCH-based marketing strategies, we also utilize many of our community partners. So here's a few that I've listed. So, we always work with our Autism Speaks chapters, and I actually worked with all of the Ohio chapter leads to make sure they knew about it. Autism Society is another one. We have the Ohio Association of Community Health Centers. That's what OACHC means. And they work with a variety, across the state, many clinics that are providing care to families in a variety of settings. So I always send things to them so that they can disperse it and share as needed. I also worked with community leads too that really work to engage families. Like we have a transition project here in the state that has, I think, 6 sessions every year that they offer. I worked with the leads on that so they could sort of distribute it. And then we have the Ohio Coalition for the Education of Children with Disabilities, and they have regional representation. So I sent it to them so again they could share it as well. I also worked with the state of Ohio, their family lead. I also have an inroad at the state of Ohio because my husband works there. Sent it to Tom and got the word out that way. And then we also worked with the county board and state communications director so that they could put it on their radar. And again, the goal was to make sure that we got this out to as many families who could potentially be interested as possible. I also worked with our LEND parent partners, our Down Syndrome Association, all the school connections that I had. The Ohio Department of Health was another place I went to because they have a parent advisory council and they work with families across the state. And I thought that might be another great way to get some information and share. So as participants began to register, we quickly had to mobilize a process to respond to ensure that they had all the information needed for the sessions that they selected. So we designed and sent a welcome letter with every registration and sent personal invitations on how, on when each session was going to happen so that they could click on the link and then get in. So how did we do all this? Behind the scenes, we work with REDCap. So each registration, each participant signed, when they would register, they would sign off to participate in Family Echo. It's like part of the legal process that we have here for Echo here at the hospital. And then they also provided demographics that really allowed us to contact them with welcome letters and then also allowed us to see where they were from. So what cities and states they were from. So this is really helpful as our first session had, like I said, nearly 350 registrations. So designing the system that can really handle that registration was key to successfully managing the series. And I have to say, our site is very fortunate to have a support team. Nancy's on the call. Who make this happen for every session. They are, a team of coordinators who are really well versed in Echo, and they have been the key to making all of this work. And we have, we constantly learn, redesign, and improve. And I think everything we did from last year to this year is probably going to be completely different because we've learned so much along the way. We also looked at what we could offer beyond the session and designed some of the following. So this means that you're in the session and, what can we give to you now that you're part of our series? So we looked at offering certificates of attendance when we're reviewing this right now to see if we can streamline that process. But a lot of participants wanted this and wanted to be able to share back with, especially parent professionals, share back with their agencies that they were, in ongoing learning. So we definitely offered that. We also wanted to offer access to care, which means a direct line to clinic care coordinators who followed up 24 to 48 hours post-session. So when we would see those, or if somebody would chat in something, or we would get an email, we would make sure that we always went back to our clinic coordinators who, dedicated themselves to following up 24 to 48 hours with whatever the question may be. We also looked at resources, related to the session, as well as general resources like, toolkits in multiple languages from Autism Speaks and the Autism Treatment Network. We just made sure families always had access to those things. And then direct answers to questions, whether it was from the live session or from our ATN email address that we have, we always made sure we address those. The thing that was nice is we utilized our ATN email address for all the communications for this series, so that it was always housed in one location. So when we went in there, anybody who went in to look at it knew that they were managing a lot of the Family Echo work. We also followed up to anyone displaying high-risk behavior that might have been in a session. We had a case where there was some domestic violence going on, and she chatted in, and the thing that's nice is having this large discipline of people on the hub team. They all knew what to do and how to activate it, and it was, followed up on within, I think by the end of the day. So it was really nice to be able to support somebody in that situation. And then we always share research opportunities. We talk about Spark, we talk about Allen, and we always have that as part of our everyday template for Family Echo slides. We follow the same structure as our professional series echoes with one modification. In lieu of the case presentation, we have a case vignette. A case vignette is a case presented by the hub team member, all right, and is based on a case that they have had in clinic, and it also relates to the session topic. We decided to go with this modification as we were not sure families would want to share personal case information on such a public platform, and we also needed to ensure PHI, right? So we did this modification, and it actually proved to be really successful. So the Family Echo series follows the same structure as our professional Echo series. We start with introductions, but in lieu of calling out 120 people to say hello by name, we would call on a few names, make sure we waved to everybody, said hello. Occasionally we would have somebody who would say, hey, I want to say hi. We would say hi, those kinds of things. We utilize Chatterfall, which is, you just basically have everybody chat in a response to the same question when you say go, so it all sort of falls in, so that's why it's called Chatterfall. But we would use that, and we would ask parents or participants questions to sort of gain a little bit of information about their knowledge on this session or what they would hope to learn, again, to engage them in the process of being part of the series. So if we couldn't really unmute everybody and have them talk, it was another way to get them engaged and to learn from them. We did an overview of Zoom for everybody in every session, especially because we always had somebody who might be new. So we always talked about, having fun with filters and positioning your, webcam effectively. I only had to turn off someone's camera once, and it was because she kept showing her foot, and it was really odd. So I thought, I'm just going to turn that off because it's a bit distracting. But for the most part, we never had any really mute issues or camera issues that we had to deal with. That would have been the only one. But again, we reviewed it to make sure that everyone knew sort of the how to manage those things on their end. We also do our didactic first. So our didactics run longer than what a typical Echo session will be. Usually it's like 15 to 20 minutes. Ours were usually around 30 to 35 because we really wanted to get into the content a little bit more. And then we would always have one of our hub team members introduce a presenter and the topic for the session. Again, that level of engagement of having all the hub team members talk was really important because I wanted them all to feel really comfortable with this new platform we were working on. So after the didactic, we go into the case vignette, and I have an example here for you to see what it looks like. So in this example, the child has autism and has limited verbal skills, and there's discussion of behavioral concerns. We add in a pseudonym to help with the case while it's being discussed, so we don't just say patient. We try to personalize it while keeping it de-identified. So Caleb is not this child's name. We provide key points to the case during the presentation, and then we open it up for clarifying questions to the participants in the hub. We encourage them to unmute and chat in questions, and then we move to suggestions and recommendations from the hub and participants. And we monitor what's coming into the chat as well as from those who unmute and share. The thing that's really nice about this is that when somebody does chat in something for a participant, our hub team's really great about saying, Sherry, that's a great recommendation and resource. And, I'm glad to see you're thinking this way and sharing these kinds of ideas. So it's really encouraging that we try to reaffirm to families who have something to share that they're on the right path, and it's really great. We want them to walk away from the session feeling really good about what they've learned and sharing what they've learned. Next, we go to resources and tips, and these are all tied to a post-session satisfaction survey. So all participants are asked to complete a post-session survey to determine their satisfaction with the session, and to offer them an opportunity to share topics they would like to see going forward and things that they would like us to think about. And they also evaluate the session and the presenter, and then that data is shared back with the presenter so that they can, again, I think it's always nice as a presenter to see what kind of feedback you get from your sessions. And sometimes not, but hopefully it's always good. So in addition to resources and tips, we always offer access to care pathways and research information, and these slides are part of every one of our slide decks. So they're always embedded into the ending of the session. These are the final slides that we sort of, we end with, so that, again, this information is always very prevalent and very, very much visible to anybody who's participating. To date, the access to care pathways involved linking families to care coordinators for a variety of concerns. Some have had questions regarding diagnostic and assessment needs, how to get a referral if there's a concern for autism. There's been many that have been about marriage and family counseling, and I think, I'm sure you're probably not surprised, during this time of COVID, we've seen a lot of that happen. Others have been on, how to access treatments such as ABA or speech or OT. And again, we're happy to find those access points and guide people in those directions. And I'll be honest, a lot of them have asked, I'm not sure where to find a certain resource in my area, and they may not even be in the Columbus, Ohio area where we're based, but we will do a little bit of research and digging and send it over to them and help get them connected. The post-session survey asks 8 questions focusing on satisfaction with the session, impact of what they have learned, input to the series, And this also served as a way to get to the session recordings, resources, and slides. So it was really a great way to say, we're really glad you attended, fill this out, and then here you have access to everything that you need. A few of the questions that we asked were, I feel like I learned best practices during this session. The ECHO presenter provided information and next steps, that were helpful. And it always offered the opportunity for the participant to add in any other topics that they would like to learn more about, or that they would like to see the series add. So Nationwide Children's Hospital is part of the Autism Learning Health Network, or ALLEN, which Dan talked about at the beginning, which is a membership of 20 sites across the United States and Canada, working collaboratively and in partnership with parent partners to improve health and quality of care for individuals with autism. It's a wonderful network that I've been really happy to be a part of for so many years. As part of the work with ALLEN, we work from a key driver diagram. So I'm going to get a little QI on you here. With a stated global aim that all individuals with autism have optimal physical health, safety, and quality of life. I mean, that's what we work toward every day in everything that we do. Our work with Family Echo in part addressed the how, or the interventions geared toward activating patient and family partners. And I will share some of the outcomes of this work on a later slide. But we really looked at two of them, and one being that we're going to ensure that families have access to information, supports, and resources they need to care for their child, and the other were one providing training on use of behavioral supports for families, such as visual schedules, ABCs, those kinds of things, which we covered in some of our sessions. So we really felt like we were able to tease out two of these things and make it part of our ECHO work. So as part of that ALLEN key driver diagram work that we did, we had a QI project that we measured across all sessions. And we tracked the response data that we would get from this question. Participation in Family Echo improved my knowledge and ability to care for children with developmental disabilities, and including autism. And that was one of the key things we wanted to know is, when you participated in here, did you feel like you walked away with something that, gave you a little nugget or a little tip or a little idea or a resource that just really made you feel like it improved your ability and your knowledge to care for that child? So we tracked participants' responses for this, again, with a hopeful goal that we would have like 80% say yes, to, definitely feel like that it had this impact. We tracked it across all of our sessions, and, our average right now is 91%. So we feel really good about that. We're going to probably move the bar for next year to see if we can get it up maybe to 95%. But we were really excited to see that the response to the work we were doing was actually having impact back to our families. And we're hopeful that what we roll out for this year will do the same. So I wanted to talk a little bit about the reach, because I think we're still surprised by this. We had 430 people who attended. Of those 430 people, they attended a total of 1,507 times. So we had people who came for 1 or 2 sessions. We had people who came for multiple sessions. I'll tell you, I think that this number is probably not accurate, because we had a number of families who were couples. So there were 2 people on the call a lot, so only one of them got counted. But we had, again, those 26 sessions. We had participants that came from 79 out of our 88 counties here in Ohio, which was really impressive. I think one of our really big goals was to reach families in those rural communities where they have even more limited access, because they're not in the big cities where there's, all of these services that were available. We had participants from 6 states, including Florida and Michigan and Kentucky and South Carolina and West Virginia. And then we had a participant from the U.S. Virgin Islands. She came to so many sessions, and I will tell you that I'm really hopeful that I can meet her on her island someday, so we can get out of this cold weather and get into some sun. We sent out post surveys in December. So when the series was completely over, we decided to send out a post series list of questions to get a little more information. I was really pleasantly surprised that 126 people responded. And I think if you ever do surveys, that that's a really good number. I mean, I was hoping if we had 50 to 70, that would be great. And when it came in at 126, I was really, really excited to see what we were going to learn. I think one of the most profound things that we learned, and we're going to build this into our 2021 series, is that, we looked at what we looked at what families were requesting the most. And, I think if you can see on here, when it talks about the topics they would like to hear from the most is, challenging behavior is number one, managing behavior is closely second, family support, anxiety, education, and developing skills to successfully parent children with autism and other disabilities. So I feel like what we're doing is really in line with, what we offered. We sort of, I think, matched that in our 2020 series. I think that it really is in line with our Allen work that we do, and I think even more so it's in line with the clinic work and the philosophy of what we do here at Nationwide Children's Hospital. We also looked at who was attending our sessions because I thought that was, something to look, it would be very important to know that. 77 replied that they are parents and parent professionals in the field. There was an overall satisfaction of 56% that were very, very satisfied. It was the highest rating you could give, and then satisfied. So we were really happy with that. And participants also told us that they just needed 2 sessions a month, which really made us feel a lot better. So we don't have to kill ourselves and do 4 to 5 a month. Some of the other things that we found out were that the best days to attend are on Tuesdays. The best time for them to attend is at noon on Tuesdays, which will probably never happen because noon at Tuesdays is when we have a lot of professional series going. So we're trying to find out the day for 2021 and what's going to work best. They like the 60-minute length. I should note that during midway into the series, we actually tacked on an additional 15 minutes for anybody who wanted to sort of chat afterwards, and we had great participation in that, but I think we'll probably stay with the 60 minutes. And they really liked the 3-part series. 75% said they would really like to see that happen again, so we'll probably build that into next year. And then challenges. I think, ensuring that, there's time for the hub team to present is, always a challenge of, working with those clinic schedules around when parents can meet and those kinds of things. So, that's always an ongoing challenge. I think the ups and downs of attendance, we would have so many registrations come in, like we had like almost 350 for that first session and 129 showed up. So there's a lot of work that goes into managing those registrations. And then when you have that attrition of attendance, it can be a little difficult. I think the support needed behind the scenes for any echo is monumental. I have a tactical work graph that I use when we talk about echo here at the hospital, and it still doesn't cover most of what we do. And I think Nancy and I find that out on a regular basis. Like, we think we've got it, and then there's always one new thing or one other thing that we have to build into making it work. So it always keeps us on our toes. I think funding's always an issue, right? Everybody always wants, to know how do you fund these things. Our hub members volunteered their time. This is sort of built into the work that I do, so that was covered. But we're still looking for funding to continue to support this. I think our biggest challenge, and it's the philosophy of ECHO from the ECHO Institute, is they always say, start before you're ready. And we did. We started way before we were ready, and then we worked to make it, cohesive and solid during the months that we were in it. So I think that's always a big challenge, but I think it's also has had a really huge reward for us. I think some of the successes, and there were many, I think attendance and interest in the series. I think our hub dedication was so solid and continues to grow for our 2021 series. Participants' continuous input into the series has been really great. Participants continuously provide input on the topics they would like to see in the series through the registration and post-session series. And I think the thing that I think is a huge success is that the family voice is in the process and the design of Family Echo always. I think this series offers a pathway for care coordination and resources, and this really grew organically during the series, and we really hope to see that continue and maybe even develop it as a little bit more. The survey was hugely successful. To have that many respondents to really help us inform the series was great. We've also developed a writing team, and we're working to publish our results right now. But for me, I think the continued alignment of effort from parents and professionals working together to ensure that we are forging partnerships and care through knowledge sharing series like a Family Echo, I think is just the biggest success. I think that partnership through the professional and the parent and understanding what the need is, and then making sure we all have the knowledge to move forward is really one of the biggest successes, I think. So our website is it's up right now. It's not going to have anything populated for 2021 yet. because we're waiting to put that up there, and the redesign is going to happen. But if you're interested in knowing more, you can always email me directly. If there was a chat function, I would say chat Nancy too. But she's nancy.long at Nationwide Children's Hospital, or Nationwide Children's, and I'm amy.hess. So reach out to us anytime. I'm happy to answer questions or help you get connected or whatever. So thank you very much. I appreciate it.
Thanks very
Thank
much,
you.
Amy. That was a wonderful
Dan.
presentation. I think we've got time for to open things up for people who may have some questions. Lucy, can you control that, or do you have any people who've sent you any questions?
Yeah, absolutely. Thank you, Dan, and thank you, Amy, for the wonderful presentation. I have collected a couple questions. If you don't mind, Amy, I can read them off to
That'd be great.
you. The first question is, how do you prioritize which topics are included in sessions?
So you went out there a minute. So how do we decide which topics are included in sessions?
Sorry, how do you prioritize?
Oh, how do we prioritize? Well, I wish I could say, well, it's really easy. It's not. I mean, so right now, I mean, I'll give you an example. Right now, we're looking at all of the series sessions that we can have for 2021. What we need to do is go through and say, when is this hub member available, right? So that's always you always have to make sure your presenter is available. And then once we know when the presenter is available, then we start to look at them and go, are they cohesive? Do they look like they work together? Could this be a series? What could it be? And then we just start to do draft schedules and give it to everybody and have it make the rounds, and then decide what looks the best, and then are we ready to go? There's not an easy answer on that, because there's so many moving parts to the number of hub team members and the number of dates that are available, that it's really sometimes it's just saying we have to do the session at this date and time because it works. What we have tried to do, though, is we've really tried to look at what is the time of year. So I think if you look back in the one of the slides I shared was about, I think in September is when we did our, COVID in school and COVID and going back to school series, because it really felt like it fit that timeline. Initially, we started out with a lot of behavior management sessions and family support sessions, because that's what we were hearing in the clinic. So we sort of have an ear in the clinic, an ear to what our families are saying, and then we look at what's going on time-wise. Summer made sense to have a safety talk, because everybody was going to be outside and everybody was going to be at home. There was not a lot of places to go during shutdown. So we really wanted to talk about it then. So again, I think being able to draw on the multiple perspectives and input from this, wonderful hub team and the support team really helps us to design it. It's not a one-person design. It's, really taking into consideration all of those perspectives to figure out what looks like the best offering.
Thank you. Next question I have was, other than the post-session survey, do you have any follow-up with participants, and what does that look like?
So nothing formalized. So we do the post-session survey with them. They always have access to our email address, the ATN email address, so they can contact us. And we had many people who did, who would say, I want more information on this, or can you connect me to a care coordinator or something like that. We didn't hide where we were, so you could find us if you needed to through that ATN email address, and that's why it really worked nicely for us, because it was an access point. And I've noticed that people have even given it out to other families who never attended a series but have a question or a need, and they'll, Nancy and I will see things that drop in there and go, hey, there's a family in here, and how, what's the best way to support them and move them forward and what their need is. So it's nothing formal, like I said, but we're here, and we want to make sure people do know that.
Thank you. Next question was, what topics have you not yet included that you hope to include in the future?
Wow. What topics have we not yet included? There isn't anything that didn't make the cut. Like, I know when I said we had 30, a couple of them really like meshed well with other topics, so we combined them. I would like to do more on transition. I think it's just such a huge topic and such a huge need. I'd like to do some stuff on siblings, and we actually have a provider here who is a sibling as well as one of our clinicians, and I'm really excited to hear her voice and what she has to share for 2021. I've already talked to her a little bit about it. I think some of the repeat ones are some of the things that will repeat that are really highly needed are like anxiety, depression, those kinds of things, because it's been such a challenging year for so many kids and so many families. But I'm open to suggestions too. I would love to hear what I'll say the other one that I think about too is physical fitness, and how to, in a time when it's shut down, and especially for us during winter months when it's so cold, like how are we keeping kids fit and healthy? Because I think that's such a need as well. But again, I think I'll listen to the pulse of what the parents and families are telling us, and then we'll design it from there. But I would like to be able to try some new ones too to see how they resonate. I hope that was a good answer.
I think that was a great answer. I have two comments, and then, unless I hear otherwise, one last question. So the first comment is from Charlene P., who says, "Great presentation, Amy. Thank you."
Oh, thanks, Charlene.
And I have a comment from Karen Coolthal that says, "Hurrah." And
thanks, Karen. And hurrah back at you.
The last question will be, do you think anything will change for this echo post-COVID?
Yeah, we have thought about that. I mean, when lives get a little more busy and we are back in person, will it change? It could. It absolutely could. I think, again, when we look at the schedule for 2021, it's going to be a lot different. We're not going to do 4 to 5 sessions a month. We needed that when shutdown and COVID were hitting, right? Now we need, I think, something that's ongoing and consistent and sustainable. And I'm hoping that 2 a month will be well attended, well received, and meet the needs. I think we're always willing to adjust as needed. But yeah, I mean, it'll be interesting to see, because I don't know how a lot of us will act when, we're back into a lot of in-person. So maybe we'll do some in-person family echo sessions again. Who knows?
Great. Well, just to close up, I wanted to say thanks very much again to Amy for the wonderful presentation. Thank you to Dan for the wonderful introduction, and for all of you for attending. Like I mentioned at the beginning, this was recorded and this will be uploaded to our YouTube channel, and the link will go out. So feel free to watch again and to share with anyone who you think might be beneficial, and stay tuned for more information about the next AARC webinar. So thanks everyone, and thanks Amy.
Thank you.
Thanks, Amy.